A very good morning and welcome to the show. The only way to start your day. Good morning, Kenya. Such a pleasure to have your company the last hour of this program, 8 to 9, which by the way finds us discussing health matters each and every Tuesday, this being no different. And before we even start with the conversation that we're about to have this morning, kindly let me remind you of the good tidings we've got for you this Easter. Or are they Easter eggs? Yes, I think good tidings is more for Christmas. We got some Easter eggs for you this holiday season. And all you need to do is to get to our SMS platform. That's 22162. Tell us what you love the most about this show and what you think we should improve on. Courtesy of that, 6 of you will get a package that includes free dental checkup at one of the centers right here in Nairobi. And yes, we've been doing our discussions or studies on this show, and we know if there's an area people neglect, it's dental. I think we think after brushing 3 times a day or twice a day or once a day, we're good. But we need regular checkups for our dental structure. Sawa. And we're giving that to you free of charge. 6 of you will get that package. Just kindly tell us what you love the most about this show and what you'd like us to improve on, and we shall be letting you know, getting in touch with you and giving you that very package, and you can redeem it as and when you're ready. Sawa. That's the drill. Yangu nimefanya, kazi kwako sasa. Now moving on from that is that we did tell you yesterday and also this morning that we shall be having a discussion around cleft lip. I'm a cleft palate. And it's a condition that disturbs people, families, those affected. At times, knowledge about it is not very clear, it's not out there. Information is power. So we need to empower you this morning, give you all the information that you need in as far as this condition is concerned. And it's not a death sentence. There is life after that, as you will witness from one of my panelists this morning. She went through it. She's fine, she's beautiful, she's pretty, and she's living her life 100%, total quality of positive vibe. I'm introducing her right now. It's Milkha Moment seated to my immediate left. How are you?
I'm fine, thank you.
You're doing well?
Yes.
Good to see you.
Good to see you too.
Karibu sana.
Asante.
And to my extreme left, I've got Dr. Esther Njoroge. Yes. Relations restricted to the profession. How are you, Dr.?
I'm fine.
You're doing well?
Thank you. Yes, I am.
Welcome to Good Morning, Kenya.
Thank you for having us.
And maybe I can start by you telling us a little bit about yourself, what you do.
My name is Dr. Esther Njoroge Moreidi.
Yes.
So the relation, maybe we go ask our parents whether there's some connection there. And I am a medical doctor by profession. I went on and studied public health at my master's level, specializing in health systems management. And I am the vice president and regional director for Africa at SmileTrain. SmileTrain is a global charity that is focused on the treatment of cleft lip and palate. That is the surgery and the comprehensive care after the surgery.
You've done this for 10 years now.
Yes.
As far as the cleft lip and the cleft palate are concerned.
Yes.
Is the difference the same? Or is it 2 different things?
They're 2 different things.
Yes.
I will describe them individually. Lip is your lip, your lips. Palate is the roof of your mouth. When you put your tongue up, the part that you touch, inside your mouth, the part that you touch,
inside.
Yes, like is the roof of your mouth. Yes, that is called a palate. All right. And cleft is a gap. So when we talk of cleft lip, it's a gap on the upper lip. Mostly it's the upper lip. Rarely will it be on the lower lip, and if it's on the lower lip, it's possibly traumatic. And when you talk about cleft palate, it is a hole in the roof of your mouth. So you can have cleft lip or cleft palate or cleft lip and palate, meaning you have both a gap on your upper lip and a hole in the roof of your mouth.
Na tafadhali tuelewane, it's the upper jaw, si mwanya. No, it's the upper jaw inside Jew.
Yes.
All right, that's what we're talking about when
Yes.
we refer to the palate.
Yes.
The lip, it's right here.
Outside where you can see it.
Where you can see it. Let me cross over to Milkha. A bit about yourself.
Like I said, I'm Milkha Moment. I'm currently working with Greenworld, so I'm a health distributor at Greenworld. Yes.
Your journey with yours was a cleft lip or a cleft palate?
Mine was cleft lip.
Yes.
Yes.
This is a condition usually at birth.
Yes, so it happens when the baby is still in the womb, not yet born, very early in pregnancy. So a baby is born with it. Yes.
So it happens in the womb.
Yes.
What conditions predisposes a baby to get it?
There are many reasons. We call them risk factors, meaning if a mother is exposed to those, the likelihood of them having a child with a cleft is higher, but not guaranteed. And some of them are, if a mother's nutrition is not good and they're lacking folic acid, or in the food it's called folate, which is a vitamin among the B group. If a mother is smoking or taking alcohol very early in the pregnancy, there are some medications if they take very early in the pregnancy, or exposure to environmental toxins like lead. There used to be paint that was lead-based. Or some who are living around mines. Those toxins could inhibit the growth of the baby, because the way the face develops, all of us had a cleft at one point when we were developing. The face grows to join together and become complete. If that joining is stopped for one reason or another, maybe one of those risk factors, or some genetic predisposition, or anything, we really don't know exactly what happens, or something in the genes, then if that is stopped, it does not join. And so it does not become complete like you and I, and then the baby is born with a gap. Yes.
And when you say drinking alcohol or smoking at an early age of the pregnancy, we're looking at the first trimester.
Yes.
The first 3 months.
The first 3 months. Between 1.5 months to 2.5 months, going to almost 3, that's when the face is formed.
Okay.
And I want to be very categorical that it's not that the next mother you meet, you tell them you took alcohol when you're pregnant, that's why your baby had a cleft.
Shida yako ni pombe.
It is not. Those are risk factors that have been studied and seen to increase the risk. Increasing the risk means you and I, if I'm taking alcohol very early, the likelihood is much higher than you who is not taking. And that's why mothers are advised, if you're planning to get pregnant, if you're already pregnant, drop the habits for at least 9 months until the baby comes out. But I want to be very categorical that it is not a must that a mother whose baby had a cleft, that they smoked, that they took alcohol, that they took some medication, that they lacked folic acid. It's an interplay of many factors that we cannot pinpoint. This is the one.
Genetics has anything to do with it?
It's, yes, it has. It's hereditary, meaning if there is somebody in your family who had a cleft, the likelihood of somebody else having it is much higher. So yes, it does play.
Let me cross over to Milkha. When you were a child growing up, to the best of your memory, as far as you can remember, did you feel anything different with you? Did you feel as though you didn't fit, or society did not embrace you enough? Let's talk about that part of your life and how it was.
Yes, at some point you felt as if you're different from other kids because you go to school and maybe a child comes to you and asks you what happened with your lip, nini umefanya hapa, and then you're like, you don't know how to tell the child because you're also young. But you end up telling him, I was born like that, or I was injured by somebody. Yes.
But you know, children, we never used to phrase it like that. We are mean. Kids are mean.
At some point they will tell you that uligongwa na nani ama uliumwa na nani, like that. Yes.
They will put it in a way that would
In a
hurt
weird
you.
way, actually, yes.
Yeah. And at what point was it corrected?
At first, it was done few months after birth, so that one I can't remember, but I had a repair on 2008.
2008.
Yes.
10 years ago.
Yes.
Isn't it? She mentions the first part, and then she had a repair. Does it mean that a reconstruction of cleft lip or cleft palate happens in phases?
There are different stages to the treatment of cleft lip and palate.
Yes.
The first stage is, let me give you an example of a child who is born with both cleft lip and cleft palate. The first stage, the ideal process is the first stage is repair the lip at 3 months, minimum of 3 months. Then the next stage is repair the palate at minimum of 6 months, mostly around 9 months or around 1 year because of many factors. And then after that, depending on how severe the cleft was, the child may need speech therapy, they may need orthodontics treatment to align their teeth. And then around 12, 13 years, they have what we call an alveolar bone graft, which is where the cleft is, the gum has, the bone there has a gap, so a tooth will never be able to hold at that spot. So they put a piece of bone there from part of the body so that the tooth can hold, and then you can have the teeth aligned. Occasionally, when a lip is repaired early, when the child grows up, the scar may not grow at the same pace as the rest of the lip, or maybe at the initial repair it wasn't done very well, and then it needs to be repeated, what we call a secondary repair. And we see that sometimes. And also, depending on the severity of the cleft, it may be done in stages where you first get the lip being what we call adhesion, so that it reduces the gap, and then they come and do the definitive repair. For her case, I have seen the photographs of 2008. I don't have the earlier ones. It was not complete. There was a notch that needed to be fixed for the lip to be complete. So sometimes it may be in stage, not that it's done in stages, it may need to be repeated.
Yes.
Yes.
Out of need.
Out of need.
Out of need.
Yes.
It's not mandatory that it happens in phases, but there could be a need that could necessitate after one procedure is done, another is done, just to cure various issues that come with the cleft lip and palate. By all right and means, Milkha, you are a very beautiful woman.
Thank you.
That I will give to you, hands down. 10 years ago, forgive me if I'm wrong, but I'm thinking you must have been a teenager, maybe high school, early college.
I was in class 8.
You were in class 8. Sorry for adding a little more age. But you were in class 8.
Yeah.
I believe this is a very formative stage where you're aware of your surroundings. Getting into teenagehood, if not there already, and this could have been an issue that disturbed you a lot, and you thought you were different. You thought you were not good enough. You didn't feel pretty enough. Maybe there are things you wanted from life, and you felt your condition was hindering you from getting them. How did that young girl at class 8 handle all that? How did you process all that? How did you gather the strength, Milkha?
After the second surgery, okay, at some point when I was younger, the first surgery which was done, like Dr. Esther said, there was a gap. So at some point I was even going with my mouth covered because I didn't want to be asked questions. But later, after the surgery, it was perfect. I loved it. I started taking pictures and everything. And even the other students, or now I was in high school, they were like, some of them, we went with them to high school. So they liked it. I also liked it. Yes.
Was it, what kind of care did you go through? How long did it take to heal? Let me begin there.
It took like 3 weeks.
3 weeks?
Yes.
This was before
I was
or after?
off from school.
Oh, you were off from school,
Yes.
so you hadn't sat your KCP yet?
Yes, I took a break to stay at home since so that it could heal.
It could heal.
Yeah.
Preparation for surgery. It has to, was it you know, a patient, get them to the theater just like that?
No.
What kind of preparation goes into a patient who is getting into the theater for the reconstructive surgery?
It's like any other surgery because it is a major operation, much as it's a simple one in the sense that in the hands of an expert, it can be as short as 45 minutes. But it's like any other major surgery. So a child or an adult or whoever is being taken in for surgery needs to be prepared. First, the doctor will see them, take their history, get to know things around their health to ascertain whether they are fit to have major surgery. And then they will do some lab tests, which include some blood works to check the level of the blood, to check whether they have any infections that would complicate the surgery. And then before the surgery, they need to fast, so they don't take meals. If it's an adult, they should not take meals for at least 6 hours. And then for children, we give, depending on what the child is taking, if it's solid food, 6 hours, if it is cow milk, 4 hours, if it's breast milk, 2 hours, so that their body is prepared for the anesthesia, which is the part that puts the person under so that they are asleep when the surgery is taking place. So first we ensure that they are fit to undergo the surgery physically, and if there is anything that needs to be addressed, oftentimes because these children when they are born, they have problems feeding, they will come when their weight is low. What we call malnutrition, and they need to be built up, their weight needs to be built up so that they can withstand the surgery. We also look at infections. If because of the mouth is open, there's a communication from outside all the way to the throat, they get recurrent infections, whether it's upper respiratory, being up here in the throat, or it's in the chest. So we check for infections, and if there's an infection, it needs to be treated before they can go for surgery, because that would complicate the surgery. And then we look at the blood level. Because it's surgery, they will bleed. And we want to be sure before they go in that they have enough blood that if they lost a little bit, it would not affect their system. And those stages have to be done by a qualified medical professional, preferably a pediatrician, if not a medical officer. They have to be reviewed by the anesthetist, and then they are prepared by the nurse by ensuring that they do not take meals in readiness for the surgery.
In readiness for the surgery. Is there anything like a minor cleft and a severe one? Is there anything like that?
Yes. Because as I told you, the way the face forms, it's like a jacket being zipped. So it could be a small notch on one side. It could extend a little, what we call incomplete, or it could go all the way to the gum, what we call a complete lip. And then if it extends beyond the gum into the palate, it's a cleft lip and palate. If it's on one side, we call it a unilateral. It's only on one side. Like Milkha's is on one side, it's a unilateral cleft lip. If it's on both sides, it's a bilateral cleft lip, and then it can go bilateral cleft lip and palate. So in terms of severity, from the notch, which is the simplest and the easiest to manage, all the way to the bilateral cleft lip and palate, that is the most severe. And sometimes it could extend all the way to the nose in some very severe cases. Then that is a spectrum of severity. And that also dictates how long or how complex the surgery is going to be.
Okay. Now, in a bit, we will be running some images. Daktari will be helping us understand what exactly is going on with those photos, what kind of, effort, let me not call it an effort, but what kind of surgery went into reconstructing these particular cases. It's also good that we warn you that some of the photos we could run could be a little disturbing for you, so kindly bear with us. We are doing this for purposes of this discussion. In a bit, those photos are coming up. As soon as they are ready, we will have them on screen, and I'm told they are. So maybe we can start with the first one. That is an after photo, isn't it?
Yes.
Maybe we would begin with the first one. That there you go. Now, this photo on screen, Daktari, what can you tell us? Is this a cleft lip and palate or cleft lip peke yake?
From what we are looking at, what you can see is the lip. So we can say it's a cleft lip, and it's both sides, cleft lip and palate. But sorry, it's a bilateral cleft lip. But because I know the patient, I can tell you it was a cleft lip, bilateral cleft lip and palate. It was going all the way in.
Yes.
So it's bilateral because it's on both sides of the face, of the lip.
Right.
Yes.
And let's get the after for that particular photo, kindly, if we may. After photo for that, the after photo for that particular case study right there. Okay, I'm being told it's being prepared, so there you go. How did we move from what we saw to this? Because you can see the change is very evident.
I know, right?
The change is very evident. The way the face looks is definitely well enhanced. Smile train this is.
Yes.
So maybe you can bring us up to speed with what exactly went behind reconstructing this case.
As you can see, the transformation is phenomenal. You can actually confidently say those are two different people.
Yeah.
Because one person looks different, the other one looks completely different. And that's the magnitude of, you may feel like it's a small problem. I mean, it's just the lip.
Yeah.
But your face carries your personality. It's your window to the world. It's who you introduce yourself to the world with. And when you look like that, even the viewers who have looked at that gentleman, and these photos are used with permission.
Yes.
How do you feel about that? Now imagine this gentleman has grown all his life looking like that. Do you think he was walking around like that? Likely not. Chances are he was covering his face. But the moment the treatment is done, the moment the surgery is done, that was immediately after surgery. Complete transformation.
Right.
A very different person. He likely would have to go get an ID again because, I mean, you show up and no.
You're different.
You're very different.
This is not you.
Yeah.
Yeah. Coming to you, Milkha, you took 3 weeks off and you had to go being taken care of and everything. When it comes to recovery, what exactly did you look out for? What were the issues daktari alikuambia? Make sure umefanya hii na hii na hii, uzingatie haya na haya na haya, itakuwa tu sawa.
First of all, the doctor knows me. So he knew that I laugh a lot. I like laughing a lot. So if I laugh, the lip will come off again. Yes. So, and he told me if I laugh, I'll have to go back to the surgery again. So I didn't want to go back there. So I had to, like, when I'm laughing, I do like this, then laugh, so that it doesn't stretch.
Okay, so unaskuma kidogo.
Yeah, you skuma so that it doesn't,
and then unacheka. Ukimaliza unaachilia.
Unaachilia, and then you have to laugh again because you're doing funny things.
And when we say it's the simple things in life that count, there are people who actually doubt it.
Yeah.
We're laughing out loud right now so freely with no caution whatsoever.
Yes.
But she had to skuma kidogo, cheka, maliza, wachilia. What else?
You have to eat soft foods so that you don't again stretch while you're opening your mouth. Basically, that's the only things I remember.
Did it come with any kind of side effects for you?
No, actually.
None whatsoever?
None.
Included?
Apart from missing school, there was none other.
So the nature of the medication that is given has got no side effects?
No. The treatment is surgical, meaning they cut, they fix, you go home. You will maybe be given an antibiotic ointment to apply on the wound as it's healing. That's it. Because the preparation before surgery is such that you are optimized for the surgery. There are no complications beyond that. And as Milkha said, the instructions given are to do with ensuring, especially when you have the surgery being done on a baby who will go climb walls, who will go jump up and down, the mother has to be very careful that this child is being managed and contained in essence, so that they're not getting it pulling apart. Recently I saw one who had a bilateral repaired, and I don't know what happened. The mother says she fell, but it came off, and now you have to go back to theater. And first you have to wait for it to heal, because you can't take back immediately.
Yeah,
and then you have to go back, and yes, it's traumatizing. So mothers have to really take care of the baby. It's a tough few weeks, but the results afterwards are way better than if you had let the child go about their business. And then the kind of foods that you give have to be soft. Sometimes you have to start with liquids and then move to more tougher things like uji, and then you can, when the wound is completely healed, you can proceed to regular food.
To regular food.
Yes.
Before we get to the issues around cleft lip and palate, there's another photo that I saw, and the viewer will get the liberty of getting it right about now. It's of a young girl. I think she has a purple hijab and everything. There is the photo that we're talking about. This is still a lip, isn't it? If that photo may stay on screen for a while longer, so that our viewers are also able to see what we are looking at, that is also a lip.
Yes, that is a cleft lip, unilateral. It's on one side.
It's on one side.
Yes.
The first one we saw was bilateral.
It's on
now
both
this
sides.
is unilateral,
on one side.
On one side.
Yes.
What is the main, what can you say is unique about treating a bilateral versus treating a unilateral cleft?
There is nothing unique.
Nothing unique.
Nothing unique.
Right.
The only difference would be the bilateral may take a little longer in the theater than the unilateral, but it all depends on how the expertise of the person doing the surgery and how wide the cleft is and the severity.
The severity.
So the only difference would be in the length of the treatment, but in terms of, and obviously because of the length and because of the severity, they will use more materials, sutures and all, but in terms of the treatment, there is not much of a difference.
There's not much of a difference.
Yes.
And of course, you will be getting to see the after photo. If we may get that for our viewers, please. The after photo of that particular lady who had that hijab as it comes up. Let's get to appreciate, because there are people who are asking me, how does a cleft palate look like? So there is the after photo.
Yes. So what you can see is immediately after. So you can see she still has sutures on her face. And once those come off, often they use absorbable suture, which means she won't have to come back for them to be removed. They will fall off by themselves. And once they fall off, all that is left is a small line, that what you can see on Milkha, which was where the repair was done. And that's it. It's treated.
It's treated. And how long does it take to heal completely?
Completely, it would, the normal healing, wound healing process, complete healing is 90 days. But within a few weeks, the sutures are fallen off, the seal is done, and you can go on with your normal life. The rest of the healing is internal, which is what would take 90 days for the wound to be very strong and not to give way.
A period of 90 days?
Yes.
How are the 90 days for you? I know earlier you said soft foods, and you had to minimize with the laughter. Better yet to do away with it. Tricky sana also. But then again, for 90 days, how are you able to brace yourself for also the changes, the new look, the before and after, managing the excitement and everything, Milkha?
It was total transformation. Bearing the mind that how I looked and how I now looked, it was okay. I loved it. And despite just being away from school, and then I was expecting my KCPE, sorry. So I actually had to repeat class 8.
Oh.
Yes, because I missed a lot. Yeah.
Yeah. 3 weeks.
Yes.
And then the healing period of 90 days later, there must have been a lot of interruptions.
Yes.
So other than that, every other thing went cool. All right,
okay.
went cool. For 10 years though, Dr. You've been doing this, going out there telling people there is hope.
Yes.
You can get your smile.
Yes.
The quality of your life can improve. But I'm very sure in the course of that decade, you must have identified issues that need to be discussed.
Yes.
Issues that need to be projected out there that are associated with cleft lip and cleft palate.
Yes.
Let's talk about those right about now.
When a baby is born with cleft lip and palate, other than the medical professionals, likely the first person who will see that baby is the mother, because the baby is delivered and shown to the mother. And for many of the parents I have interacted with, they did not know, much as it's possible to tell with ultrasound, they did not know before they had their baby that the baby had a cleft. And the first time they're seeing this baby, every one of us will expect a perfect 10-toe, 10-finger baby, and then there is something on their mouth, and it's shocking for the parents. And for many who have not even heard about it, have not heard about the treatment, their first thoughts are, what now? What next? And we have treated many here in Kenya who have gone on to live for years without the cleft being treated. And they have had difficulties. As you have seen with the photos, the mouth is open. When you're feeding, it's difficult to feed. You can't close your mouth and chew like your mother used to tell you, chew while your mouth is closed. That man, that woman cannot do that. That baby cannot do that.
Right. If I may interject a bit, that's a palate.
Yes, that is a cleft palate.
That is because it's inside.
It's inside. The way you tell, the pink that is on the sides is different from the one that is in the middle.
Yes.
The one we are seeing in the middle is actually the nose. It's not the mouth. So when there's a cleft palate, there's a communication between the nose and the mouth, which should not be there in normal life. So when this baby feeds, the milk comes out of the nose, because instead of going down some of it comes out of the nose. It's difficult, and sometimes some of it even goes into their lungs because of the inability to be able to push it down into the stomach. And because of that, they get recurrent infections. So this is a child who will grow up sickly. Even as long as their cleft has not been repaired, they will be having recurrent infections. They will not be feeding well, so their weight they will not develop the normal way like the other babies do. And they will come when their weight is low for many of them. They are not able to latch on the mother's breast and suckle like normal children, because they can't create that vacuum when they have the cleft palate because of that space.
Yep.
So the mothers give up on breastfeeding because you're putting the baby on the breast, they're not suckling or they're struggling, and you have to assist them. So part of the education that Smile Train and our partners provide to the mothers is on how to feed your baby. Exactly. Because we also want this baby to get exclusive breastfeeding. It's the best for the baby. It's the best for their development. So your baby may not be able to hold on to the breast. So what do you do about that? If it is a lip only, with positioning, you may be able, the baby will be able to latch and breastfeed. So they are taught how to position upright, keep burping the baby every few minutes, so that they take in a lot of air, grab that air comes out, and they can continue feeding.
This is after?
This is after.
After the surgery? It has
been treated, yes. So it has been closed. It
has been closed?
Yes.
Maybe earlier on you did explain to us exactly what happens with a cleft lip and how the reconstruction happens. But for a cleft palate, is the procedure the same?
It's more or less the same.
Yes.
Because it's about bringing what should have joined together, bringing it back together.
What you called zipping up.
Yes. So it's creating that zip that never happened. So it's about bringing the tissues from the sides and completing that seal. And it's all through surgery.
Through surgery?
Yes.
Still takes 90 days?
This is even for when you're cut. If you're cut somewhere, you may not see the process, but the process that goes on for you to say this place is completely healed, it takes 90 days. But for you to see it's sealed and there's no blood coming out and there's no, if you pull it, it won't tear apart, it takes a few weeks. And then it's done and you go on with your normal life. The rest of the strengthening of the wound is what takes 90 days. So it will not, a child will not have challenges all the way to 90 days.
Yes.
What they will have challenges with is the first few weeks when the wound is fresh. And that's when, if they fall, it will give way. If they eat tough food, it will come through. If they
laugh out loud.
Laugh out loud.
If they laugh out loud, it's going to come.
Yes.
Yes.
So the first few weeks are the ones that you really have to take good care of that baby. You really have to ensure they're not getting themselves hurt. And then after that, they go on.
Everything is fine.
Yes.
Before I cross over to Milkha, there's an issue you mentioned, that this is a condition that can be noticed through an identified through an ultrasound.
Yes.
At what point should an expectant mother go for a checkup and request that this kind of a condition for the person to look out for? Like if it's a nurse doing the ultrasound, kindly look out for this and that.
You can't go and request for an ultrasound.
Sorry, I'm sorry. The request.
The request would be.
I felt I was a bit wordy phrasing, but the request is maybe as you do this, as you do the checkup, could we kindly
check for this?
Check for cleft.
Yes.
Yes.
The normal, when a mother is expectant, there are recommended stages for them to go for ultrasound checkup. Basically, it's to look for the formation of the baby, not just cleft. Is the baby developing well? Are they adding weight well? Are they growing well? Is their spinal cord growing properly? Are there any problems with the development? And during that time, when the ultrasound is being done, that's when the person doing it can actually notice that there's a cleft lip, and they would ideally be able to see it from 20 weeks. From 20 weeks. Yes, because onwards, then the baby has developed and the structures are more defined. But I'm not an ultrasound expert, so if I have misquoted the 20 weeks, forgive me. But from 20 weeks, because the baby is fully formed, it is possible for you to tell whether the child has a cleft lip. Lip is the one that can be diagnosed on ultrasound. Cleft palate until the baby is born. Until the baby is born. Yes. And when I asked about the issues around it, you said mothers give birth and they realize all is not well. What's your experience with those kind of mothers? You know, new mothers expecting a bundle of joy. Yes, the bundle is here. Joy is in the air, but you feel some reservations. How do you go about dealing with counseling and helping these mothers accept the reality, number one, but number two, embrace the possibility that this can be corrected? The first thing I would say is every mother loves their child, regardless of how they come out. And for us and for the medical professionals is to reassure this mother that something can be done. And the person who is with that mother when she delivers is very key in helping this mother cope with the reality. The baby has come, yes. He has a cleft, yes. But you know what? It can be treated. It has been treated. Your baby will go on to live a normal life. They will go on to finish high school and continue on with extra education or go on and work somewhere else, as long as you take them for treatment and the surgery is done in a timely manner. That first interaction, most times it's with nurses, because a lot of times it's midwives who deliver the mothers. Sometimes it's in the village when the mother has not delivered at the health facility. But as more awareness is created about delivering at health facilities, we are seeing those home births reducing. So a lot of the times it will be with a nurse. And as Miltrain, we and with our partners, we are working, and by partners I mean the hospitals that we work with. We work to educate the health providers so that they know where to refer this mother, because this mother just wants to know, okay, what next? Where do I go from here? And the information that this will be treated, and then the extra bit, it will be treated for free, because Smile Train, when we support our partners, they offer the treatment free of charge. That reassurance by itself helps a mother cope. And when you meet, oftentimes I will meet the mothers much later, and they're telling me the story from the time the baby was born. It's a story of hope. They've been knowing, I'm building my baby's weight because at 3 months, the lip is going to be repaired.
Yeah.
That also gives them hope to take care of this baby and ensure they're feeding well. It's hard. It's a hard job. Burping a child every 5 minutes is not easy.
It's not easy.
It's not easy at all. And expressing milk and feeding them with a cup and spoon, if they cannot breastfeed at all, it's not easy. So this mother is given that hope that 3 months it will be fixed. Then they have the energy to do that difficult work for those 3 months.
How do you feed, how does feeding exactly happen for a child who has a palate? Because you said as much as they will take in the milk, it will come out through the nose.
Yes.
So how exactly do you manage that? How do you ensure that they properly feed?
One, you feed them seated upright, so that you're likely to get the milk down. There are special, I'll call it a teat. It's not a teat exactly. That is a spoon, so that the milk comes and drops on a spoon and gets into the baby's mouth. They are not readily available. But what is readily available to every mother out there is a cup and spoon. So you express in a cup and you feed that baby with a spoon. It's tiresome, I can tell you that. I have watched a mother do it. I have helped a mother do it. It is tiresome. But at the end of the day, you remember it's for a while.
Yeah.
And then it will be over.
Then it will be over.
Yes.
Yeah. All is well. All is well. Let me come to you, Milkha. Moments close to your heart. Moments really fresh in your brain. In terms of how you were able to deal with this. I'm very sure people may have done things to you, said things to you that were really hurtful. Others may have come through for you in such a special way that you felt this is an awe moment that I will treasure for the rest of my life. Could you share with us some of those stories? And if there are people you would like to appreciate that made your journey worthwhile, this is your moment.
Let me first appreciate Dr. Esther. She met me in a funny way. I was working at Cure Hospital in Kijabe. So I was registering kids with cleft lip. And then they just walked in because that was their organization. That's what they were doing for those kids. So she stood beside me, and then she looked at me, and then she was like, "Can I see you?" And then I was like, "Wait a bit, let me register this." Then I went, then she looked at me and asked me whether that's a cleft lip, and I was like, yes. Since then, she has been calling me in many events, and in fact, other parents were asking me if their baby can be like me. You find a parent comes with her child, then she's like, "Mtoto wangu anaweza kuwa kama wewe." And then you're like, she will even be better than myself. Yeah, so.
And she's right here. Dr. Esther is right,
right here.
Yeah, you said you would like to appreciate her. Maybe you would do that right now.
Yeah.
Just look straight into her eyes and exchange a moment.
Okay.
It's very critical. Yes, go ahead.
Dr. Esther, thank you so much. Words enough cannot be enough, but you've made me be who I am. You've made me appreciate myself, and then the way you even help other patients, it's a great honor. Thank you so much. On behalf of other cleft lip patients, palate patients, we want to say a big thank you to you. May God bless the work that you do.
Thank you, Modoni.
Yeah.
Actually, the gratitude is to you, because you have helped us as Smile Train, the organization, and me as an individual, to reach out to parents who, like you said, how do I help them at the beginning? You know, there is no better message than showing them, here is somebody. They can tell you how they have gone through it, and they can tell you how it is now. It gives them, they can see where they are heading. And you, Munoni, you have been so supportive. You know, when we call you and tell you there's a mother to talk to, I'm really grateful. Yes.
You're welcome.
You know, when you come with moments and then you literally give me a moment, it gets overwhelming at times. But it's such a pleasure to see two ladies dedicated to improving the quality of lives of children, mothers, and families out there. What you're doing is commendable. Keep doing it. And I believe we're getting to higher places. We're not winding up the interview yet. There are a few issues we need to address. And Milkha, you were saying you'd like to begin appreciating those that have made your journey worth your while. You started with Daktari right here. Maybe there are others that you'd like to mention.
Yes, my parents also. My dad, actually my cleft lip, I inherited from him. He has a cleft lip. I have a cleft lip. My small sister has one. And I just want to appreciate him. He is one in a million. He is a single dad, and he has raised us in a godly way.
Perfect. Amazing.
My relatives also.
Yeah.
They have also been so supportive. My grandmother, my grandfather, my aunts, my cousins, they've been of great help.
Yeah. Great. Dad, you're doing an amazing job. Your daughter just said it. Thank you so much also for making sure that she's seated right here this day sharing this story. However, there are people who just, you know, I call them special. They introduce conflict in your life, but that conflict comes in to shape you and make you a better person. Maybe what's the greatest misunderstanding that you went through when you were dealing with the cleft lip situation? Ama mtu akakwambia kitu ukafeel, I'll talk about it one day on TV.
Let me not talk about that.
Fine. Yeah, but there are.
She's a wise woman.
She's a wise woman.
Yes.
And she will not glorify that moment, which is very wise. But once you are faced with that, because there's so many who are watching us this morning, and maybe they're even going through it as we speak, and they're wondering now, first of all, I was born like this. If they've just gone through surgery, they have to accept that the situation is what it is. But there's also that mean voice, that mean action, those people who don't understand, and at times they make our lives difficult. How did you deal with yours, and what advice could you give them?
My advice to parents, it will be, there is hope for that child. You never know. I actually recall what my mother would have said when she got me, and maybe she thought this is the end of my child, or my child will not survive. But my advice is that there is hope for that child. Maybe after this we can give my number, Dr. Esther can give hers, and then any patient who knows, or any person who knows the child with cleft lip, they can contact us and we will refer them to the right places.
Exactly. It's very quick. Yeah, you have a great heart. That you do have. I'd like to come to you, Daktari. We've spoken of so many issues, but there is one we would like to address. Due to access and lack of knowledge, lack of access and knowledge, there are people who could be in their adult life, but they still have this condition. They have a cleft lip. Is there hope for them? I mean, or does it get to a certain age and you're like, miaka imeenda sana, we tulia tu, itakuwa tu sawa? Yes.
Smile Train is a charity for all. Everybody born with cleft lip and palate the huge gain is when we treat at a young age, because they go on and have an education and live a normal life.
Yes.
But we are also very aware of the fact that this person who is 20 years old, this person who is 40 years old, this person who is 60 years old, did not choose to live with their cleft. They had no option. They had nowhere to turn. They had no, it's an expensive surgery. If they were to pay for it, they possibly would never have afforded. And therefore, we don't turn them away. If you are fit for surgery, because you have to be evaluated to be fit for surgery, we will offer you the treatment. Because living a productive life, this lady from Wakanda who started acting at 88 years of age, living a productive life does not mean it has to have started at birth. Your life could easily begin at 20 years of age.
She just cited Wakanda. Okay, go on. We just had a Wakanda moment right here. So fine, let's go on.
Life begins at the point where you turn it around. And this could be their moment. They have lived in hiding. They've never shown their faces beyond their homes. They possibly walk around with their mouth covered. And if they had the confidence to walk not covered, they have been called names. They have had mean things said to them. But this could be their moment. This could be the moment that they turn their life around. But my prayer and what I am working towards is ensuring that nobody's growing up like that. And in Kenya, we are getting there. We are getting to a point where we are seeing more of children, less of adults. And because I take care of the whole of the Africa program, I can tell you for a fact, there are many countries where there are adults who have grown up with their cleft. There was no other alternative for them. And when you give them the mirror after the surgery, they break down. Because they imagine what life could have been if this had been done when they were children. So mothers out there, if your baby is born with a cleft lip and palate, don't feel the shame. It's nothing you did. You did not do anything wrong. Bring your child. Let them be treated. Give them that opportunity to turn around their life at that point and make a different trajectory.
Tafadhali usifiche mtoto, because I don't know what's with us and hiding, and society will say. Let me tell you, a majority of the dreams that have died is because people stopped to think, what will people say? And they held back. They never experienced their full potential. Why? They actually sat and gave a damn about what people will say. But you know what? It's your life. You need to embrace it. Reality, toa mtoto, take them to a facility, let them get evaluated. There is hope. There is light at the end of the tunnel. It's not a death sentence.
No, it's not.
It's not a death. I mean,
look at Mudoni.
Here we go. Here we go. She smiles, she laughs out loud, you know, and she enjoys life. So why would you deny your child that? And all you need to do is to get in touch with Smile Train, because you have a program where these things are done for free.
Yes.
Isn't it?
Yes.
And we could be having people watching us this morning. They may not be going through this condition, but they could know people who are going through this.
Yes.
And they're wondering, how do they get help? So how can we access a Smile Train? How can we access you, Daktari, you, Muthoni, to give help to them so that they're able to get the necessary assistance that is required?
So I will give two phone numbers. The first one is our patient helpline, and it's 0737 0737 025 803. 0737 025 803. That is a patient helpline. Anytime you call that, you'll be linked to the nearest partner hospital, because we're not working in all hospitals. We have selected partner hospitals where the treatment is free of charge.
Yes.
Call that number, you'll be directed. If you want to speak to me personally, my number, and don't call me with funny stories, I will not answer. It's 0737.
Yes. That is exactly what I'm thinking.
I have actually forgotten my phone number.
I'm thinking she has a detector. Who you see serious? Really?
No, there's always that first conversation, and then
Yes.
after that, you block the person's phone number because they're just being funny.
Right.
Let me give the other number because I've just forgotten my phone number. Honest to God.
It happens.
Yeah, I've forgotten.
It happens.
0724
Yeah.
52 9025. That's my personal number.
Okay.
And I have my patients' phone numbers in there. I talk to mothers all the time. I reach out. I visit them at home. I visit them at the hospital. This is what I do. This is my life.
So it's the same number that I have here, isn't it?
The 0737.
Yes.
Yes.
So the number is 073702580 Call that number, you will get the help that you need. And nimekusikia umesema hebu rudia tena. It's 0737025803. Get dialing that number, you will get the help that you definitely require. And all we can do as Good Morning Kenya, as Health Tuesday, as the panel seated right here, is to wish you all the best, because indeed you can smile again. Your child can smile, all right? It can happen, it will happen. Get dialing, all right? Get dialing right about now. Lucy, your final word. Oh, sorry, Milkha. Lucy is seated right there. I was looking at Lucy when I was giving the number, so I guess that's why I got distracted. Milkha, your final word as we bring this to a close.
My final word is I look forward to seeing more smiles of cleft lip and palate patients.
Yeah.
And thank you for having us.
You're welcome.
May God bless you.
Amen. Amen. God bless you too. It was a pleasure meeting you.
Thank you.
You are a hero and a warrior in society, and we celebrate you.
Thank you.
All the best moving forward. Dr. your final words.
So I have two final words.
Okay.
The first is Smile Train is not just about the treatment. We are big about the treatment, but we're also big about building local capacity. So we do a lot of training, we do a lot of awareness creation, and right now as I speak there is a conference going on. It's a Pan-African conference which has brought together experts in cleft care from surgery, speech therapy, orthodontists, nurses, come together, learn from each other, brainstorm, come out of there with standards and protocols on the management of cleft lip and palate.
Yes.
Because we all want to elevate Africa to that level where everybody is being treated at the appropriate time. And my second final word is for every parent out there. Whether your child was born with a cleft lip and palate and they have been treated, or whether they have been born with cleft lip and palate and they have not been treated, that child is special. That child's intellect is as intact as if they had been born without.
Yes.
And their life goes on to be normal and complete. Bring them for treatment. Encourage them in life. Build them as you would build any other of your children. Most times it's one child has a cleft, the rest don't. Build them up, build their confidence, and let us give these babies an opportunity to contribute to our economy. And my last one, I look forward to a time where it will not be Smile Train who are saying we are offering the treatment free of charge.
Yes.
It will be the government saying the treatment is available at every government facility, free of charge.
Free of charge.
Especially for my beloved Kenya.
Sure. Through public-private partnerships, PPPs. Aren't they wonderful?
Yes,
They just
are.
inject a lot of life into systems, isn't it? And that is a direction the government should look into, embracing and making sure that every child is accorded the right to smile and to live to the best of their ability. My final word would be thank you to the panelists for coming and for sharing your knowledge, insight, in as far as this discussion is concerned. To you for watching this show, keeping us company up till now. We take it not for granted to the production crew for making this particular show a reality, and to my presenters, colleagues, Safina Chieng and Zeda Radido, for breathing life into this production and making it what it is, the only way to start your day. Remember what we told you? Easter is here with us. We got Easter eggs for you. We got gifts for you this Easter. And we are treating you to a free dental checkup at one of the centers right here in Nairobi. Very comprehensive. You will be given treatment. You will be given a checkup that you will live to remember. Sawa sawa. And all you need to do is to get to our SMS platform, 22162. Tell us what you love about Good Morning Kenya and what you believe we should improve on. Send that text, and courtesy of that, 6 of you will get the package. I don't want to call them tickets because this is not a rave or a concert, but you will get the package that that includes a free dental checkup at one of the centers right here in Hurlingham, Nairobi. My name is Samuel Njoroge. Check out my social media platforms: Facebook, Samuel Njoroge, Sammy1 on Twitter, SP Njoroge on Instagram. For more information on this, also at KBC Channel 1 and KBC Channel 1 TV on Twitter. God bless you all abundantly. Enjoy what is left of your Tuesday, and see you tomorrow right here bright and early at 6 a.m.